So you first have the leg flex up to 90 degrees. Okay. Okay, you come around the patient's legs, you may just relax. Okay, so you may hold the leg in this position, okay, in 90 degrees. From then, you bring the leg into an adducted position. Okay, any pain there? Okay, so each position you move, you ask about pain. So I would take the leg up into adduction. When will adduction stop? Okay, when does adduction stop? The minute when you see the ischium lifted up from the bed, that's the end of the movement. Because if I continue to do that, the whole pelvis will start to move. That's not what I'm interested in. What I'm interested in is only the hip joint. So it's only a small movement. Don't bring the hip all the way over. Okay? So hip flexion, you bring it up. This is the end of the adduction movement. Okay? So this is the starting position for me for hip flexion adduction. Okay, what I'm wanting to do is to move it to the opposite shoulder. So the idea is, at this beginning position, I want to move through an arc. The ending position is over at her opposite shoulder. So we're not doing flexion, we're not doing adduction, we're doing it as a combined movement. So the movement is a quadrant. Sometimes the hip flexion adduction test is called a hip quadrant test. Quadrant, quadrant. Okay? So take it over. Any pain there? Can I bring it down? Okay, so now I'm going to move that up. Okay. Okay, so when you hit, when your hip goes into the opposite direction, that's the end of the movement. So basically, you go through an arc. So you're describing this particular arc as the movement of interest. Okay, throughout that, like all our passive movements again, we observe for any pain reproduction, onset of pain when it stops. You feel the range of movement, whether it is stiff or whether there's any bumps over the area, also the onset of resistance as well. Okay, so for somebody with very tight capsule, you'll find that even in this position, they can't go any further. That's the end of the movement. You can't move through. Yeah. So for Yuki, for her, okay, so that's probably when resistance starts to feel. So let me just come back down again. Tell me when pain starts. Okay, so pain comes on a little bit over beyond resistance, but about the same. So this is the beginning of resistance. That's the beginning of pain. So how much pain?
3 out of 10.
Yeah, where is your pain? Where is your pain? At the back. Okay. So some of you might feel it over the posterior buttock. Some may feel it over the groin. I think with people with tight joints, a lot of them will feel compression over at the joint. Okay. So I might just take it. Okay. So this is resistance. That's pain. Okay. I'm going to move up. What is the pain feel?
5.
Okay, there.
7.
Okay, so I take it out. 3, and that's 5, and that's 7. Okay. The resistance is not too tight, so I'm feeling there's some pain associated with the resistance. It's not too bad. It's quite smooth. So I'm describing it. I'm drawing this in my mind. Okay. So supposedly, if the patient has got pain, even at hip flexion adduction, reproduce a lot of pain, that's the end of the movement. You don't need to carry on further because you've achieved your purpose. The test itself is positive. Okay. If it's not, then you go through the arc. If throughout this particular arc of movement it reproduces pain, there's limitation of range of movement, or you find not smooth, etc., then you achieve your purpose. You don't need to go any further. So supposedly, if you have a patient with very flexible joint, no pathology, okay, so what you can do, you can take it to the end range, and then you can add various things to it. The first one, okay, so the first one, if you have the arc where it is not smooth, what you can do, you can find the part where it's the tightest or the part that is bumpy. You stay in that position, and from there you add compression in that spot. Okay. So the compression is through this direction. You're going through the shaft of femur. So you're directing your pressure through the shaft of femur directly onto the articular surface of the joint. Okay, so you come over. That's why you need to have the patient close to you. Come around, and then you compress them like this. Okay, so this is not your tightest point. It should be here. It's your tightest point. So I press that, so I can compress through the shaft of femur, or I can nudge around, which I didn't draw. You can nudge around that tight point. For example, there's a tight part. I just move through that little arc. I just go back and not that tight. This part is the tightest. Okay, so I can go back and forth, and feel for the pain. And even if that doesn't reproduce too much pain and you're not satisfied, you want to do more, you can take it to the tightest point, and then from there you add in your rotation. There, and from there you add in that position. Okay? But normally, we may not need to add those in. But as a treatment technique, sometimes you may want to make it more aggressive. Okay? Understand the test? Okay, this particular test take a bit of skill because firstly, not easy. You need to control. A lot of people take the leg up into flexion. Remember, it's the diagonal, it's a quadrant test. So bring that over and through the arc. The other problem that people may be having is controlling the leg. Okay, that you're holding the leg, supporting it properly to keep the patient, let the patient relax. Okay, so let's practice this.